Hello, and welcome to the Informs webinar, The Challenges Facing Food Security and Ending World Hunger, where we are exploring a variety of issues around the global hunger crisis, including food deserts, food insecurity, supply chain strain, and opportunities to combat the rising challenges around the world. My name is Jeff Cohen. I'm the Chief Strategy and Innovation Officer at Informs, the largest association for the decision in data sciences. Informs members support organizations and governments at all levels as they work to transform data into information and information into insights for better decision-making and more impactful results. Informs' 11,000 members are comprised of diverse and robust experts in data science, analytics, operations research, and other related fields. Their work touches literally every sector and has been responsible for saving lives, saving money, and solving problems across a broad spectrum of areas, including healthcare, transportation, artificial intelligence, and so much more. Today, we are joined by two Informs members and leading experts as we explore how to address and make an impact against the world hunger crisis. Dr. Julie Ivey, a professor of industrial and systems engineering and a Fitz Faculty Fellow in health systems engineering at North Carolina State University, and Dr. Natalia Somerville, a senior manager of advanced analytics R&D at SAS Institute and an adjunct professor of supply chain and optimization at MIT and Duke University. Thank you all for joining us today. Natalia, I understand we may be having some technical difficulties with Dr. Ivey. So why don't I just go ahead and we'll start a conversation. If she's able to join, terrific. So as a starting place, Natalia, I don't think that people naturally associate data science, OR, and analytics with efforts to counter food insecurity. Can we talk a little bit about why leveraging data and the type of modeling that you and others in the profession do is vital when we look at solutions to hunger and food insecurity? Natalia? Well, we may be having some other technical challenges as well here today, folks. I do apologize. Well, if you're with us today, I do apologize for the technical difficulties. We're going to pause for a moment to see if we can get Dr. Somerville and Dr. Ivey back online. Please stand by. Dr. Ivey, welcome. I'm sorry you're having some technical difficulties joining us today. We are live, and we had Dr. Somerville, but she also ran into a technical challenge.
Okay.
But we welcome you and we thank you for joining us. So I'm going to go ahead and just restart my conversation, and I'll start it with you. I don't think that people naturally associate data science, operations research, and analytics with how we tackle or counter the efforts around food insecurity. Could you talk a little bit about why leveraging data and modeling is vital for looking at solutions to hunger and food security challenges?
Sure. Hunger and food insecurity is an extremely complex problem. What we see in terms of food insecurity is really the result of multiple factors interacting. So you have challenges associated with job security, challenges associated through the supply chain and the economy. We know that hunger influences things like health, it influences education. So this complexity really calls for the need for the use of data and a really complex modeling to help us tease out these interactions that are present in order to really identify ways to intervene, ways to identify systemic factors that drive food insecurity, as well as thinking about the challenge of satisfying the needs of those who are food insecure. We've had conversations with, at this point, more than 95 hunger relief organizations. And those organizations repeatedly talk about the fact that they really want to be able to understand need at the local level. Like there's data that's kind of aggregated at the national or state level, but they want to be able to get a nuanced understanding of the need of the populations in their local areas that they want to serve. In order to do that, they need data, and they need data from multiple sources that we bring together and synthesize so that we can then begin to understand the interconnectedness and intertwined complexity of hunger. So we need to be able to understand what demand might be coming in terms of need. We need to be able to also understand these complex interactions. So like if the child doesn't have food, right, that's going to affect how they do in school. We're going to see those patterns in their school data. We might be able to identify hunger need in the classroom and then not be able to translate that to the fact that a child is connected to a family. They're not an isolated entity. And so if we try to help the child in school, but we ignore the family, that in and of itself doesn't help us with the problem. And data is the way we can do that. Data, analytics, modeling is the way that we can really begin to understand factors that influence hunger. It's the way that we can begin to think about how do we actually connect the resources that are there to the people in need. So we need modeling really as a way to help us improve decision making. And if we can do it in such a way that we can support agencies and people who are, on the front lines and do it in a way that it's transparent and clear, that will help us help them to do what they need to do at a better level, distribute more food, serve more people in need. And then fundamentally, if we can do it well, maybe we can get to the point that as we address the systemic factors that cause food insecurity, we can start addressing those and actually reduce food insecurity and like really kind of get at the grand challenge of how do we make sure that all of the people, say we talk about domestic hunger in the US, actually have food that they need in order to function and survive. There's a belief that many people talk about that there is enough food, but the problem is getting the food to the people in need. And how do we do that? Part of it is identifying who needs it and how much they need and what types of food they need, both thinking about culturally relevant food, thinking about medically relevant food. And the other part is how do we get the resources to connect like food in terms of drivers, transportation, the supply chain, to actually, make sure that we reduce the waste that's in the system and connecting that food to families who need it.
So I appreciate your approach from this from a systems level perspective. Mm-hmm. And we're going to explore that a little bit more in a few minutes. But I'm wondering, but before I get there, throughout the pandemic, we've really seen shocking stories in many respects about hunger and food security in communities across the country and among people who might not have typically or historically sort of been a part of the group of people who are suffering from that perspective. I'm wondering, can you talk with us a little bit about the prevalence of food insecurity today in the United States and the work that you've done or have seen in terms of how that was amplified during the heights of the pandemic?
Yeah, so food insecurity in the US has always been a problem. It's been recorded since about the 1990s when they first started recording it. And prior to the pandemic, it actually was, decreasing, like kind of steadily decreasing. And in fact, in 2019, it reached its lowest number since it had been recorded. Now, mind you, that lowest number was still 37 million Americans who were food insecure. Now, once the pandemic hit, that number grew substantially. And in fact, there were a number of people who had not, experienced food insecurity who then did. Originally, they thought the number in 2020 jumped to 60 million. As they did some additional analysis, they now think it's around 45 million. Of those 45 million, 15 million are children. And so those are the numbers from 2020. From 2021, it's expected that it's gone down a little bit, down to 43, I think around 42, 43 million, but the numbers are significant. We also know that hunger is not, there are disparities in how it's experienced. All right, so for African-American, Black families, for example, it's about 1 in 5 families. For Hispanic families, that number is just a little bit lower, it's around the same. For Native American families, it's 1 in 4. And so the pandemic, it had a disproportionate effect in that way, but it also has had a significant effect on hunger. The challenge that we're faced with right now is that even as we kind of perceive ourselves getting the pandemic getting better for us or adjusting to the pandemic, it's not expected that people will recover from their food insecurity as quickly. They estimated during, like, say, the big recession in 2008 that it took about 10 years for the food insecurity levels to begin to go back down. And so the expectation is right now that even though the number dropped a little bit in 2021 from its high in 2020, with the increase in inflation, with the fuel cost, it's expected that we are in a situation that will be there for a little bit of time. And so we really need to think really more strategically. And I think that goes back to the first question about data and using analytics and decision modeling to help us do better and make, because the public for-profit and the nonprofit supply chain are actively interacting in this way with these challenges around fuel and cost. And so if we want to really tackle food insecurity, we've got to think about this systemic approach.
Great. So that's a great segue to my next question. And Natalia, welcome back. I'm sorry that you ran into some technical problems, but you joined us just in time. Yeah. Dr. Ivy was just sort of talking about next level aspects, if you will, which kind of gets us into the question of key drivers of food insecurity today. There's a lot, as Dr. Ivy was pointing out, that may be contributing to this. That could be more than just the supply chain problem, that's afflicting the nation and the globe in profound ways. Wondering if you could talk a little bit about that from your perspective.
Absolutely, and so supply chain issues they came to kind of public knowledge, particularly during the last couple of years. But food insecurity is known for many years before that. So I totally agree with Julie in terms of there's definitely other drivers that are also known. Some of the work that we've done here with SAS as Data for Good efforts is finding those health indexes and relationships to food insecurity to provide governments with potentially some insights into what is happening and what they could potentially do. So we worked with indices in New York City, the 5 boroughs, and looking at the different health issues such as obesity or heart disease and how that correlates to food security as well as access to healthy foods. And that's what we found. So the access to healthy foods, it's actually key for any of those health issues. And now we start working. Okay, so what does the access to healthy food, what does that mean, and which factors relate to that? And then we are coming back to that socio-demographic area characteristics of the different neighborhoods are really the key drivers. And so I was on the White House listening sessions, and Secretary Walsh was also talking about how unemployment is so very tied to food insecurity. And so we see that through data, we see that in practice. And so those are definitely some of the very relevant factors in this issue.
I appreciate that. Dr. Ivy, I know that you have produced widely respected research that looks at innovative approaches to tackling food insecurity. Can you walk through some of that work and some of the key solutions that have emerged as a result of it?
Yeah, well, yes. For about 12 years, we've partnered with the Food Bank of Central and Eastern North Carolina to really understand their supply chain and distribution network. And since then, we've now begun to partner with, I think, up to 3 or 4 additional food banks. And what we've done is really try to understand their challenges associated with thinking about the multiple objectives that they're trying to solve. So one of the things that they're particularly interested in is not wasting food, right? That's a critical piece, and we call that effectiveness. But at the same time, they don't want to be inequitable in how they distribute the food. So it could be really easy to distribute food to the areas that are easiestly able to receive it. So they have drivers, they have resources, they can pick it up, they can distribute it, counties that maybe have more access. And so we look at equity, efficiency, like the cost to distribute, and we look at how can they balance those things. One of the things that we discovered in our work, and this is from analyzing their data, that that there's this real trade-off between trying to be equitable, which they think of it in terms of, they call it a fair share. So like that not that everyone receives the same thing, but that the distribution is relative to the percentage of need or demand. And so we find that, there are these areas, counties that can be constraining, where we call them bottleneck counties, where they are restricted in the resources they have available to receive food. And so because of their inability to receive food, they're actually getting less on a regular basis. And so, and the only way we were able to do that was looking at things like some data analytics, mixed integer programming, some simulation, so stochastic modeling that helped us be able to identify those different, constraints on the system that limit the ability to distribute food. So for our food bank partner, that's helpful because it helps them identify areas where it might be critical to infuse additional resources, maybe a mobile food pantry. Maybe you need to open up additional agencies in those areas so that then those areas can begin to receive the food that they need, and that because they have the ability or capacity to do so. And so that's some of the work that we've done. We've started looking at things, kind of looking at how food banks balance these different factors. Some people in the food banking agents area say, if you talk to one food bank, you've talked to one food bank, because they're all so heterogeneous in terms of the needs that they have, in terms of the population they serve, and in terms of their desire really to be able to personalize distribution to the people that they serve and the needs of those communities. And so some of the work thinking about how do we characterize those areas and using data to try to understand, like, what are the drivers of food insecurity in this particular area? What might the need look like? Those are things we can do and understand with data, right? And help them make better decisions thinking about distribution. So that's just kind of a snippet. We've been really fortunate in that, and this is work with my colleague, Dr. Lauren Davis at North Carolina A&T State University, that we've worked for many years. But we've been able to have support from the National Science Foundation to help us really, connect with these nonprofits so that, like, it's not an expense to them, but it helps us be able to really, drive thoughts forward and thinking about how we can help them really be as effective as they can be in their goal. And their goal is really to help as many people in need as possible.
Dr. Ivy, and Natalia, if you don't mind, I'm going to deviate from the questions we prepped with. Something you said sparked a question, Dr. Ivy, and that is, as you've done your research and as you worked with your food bank partner, have you identified an area or two in the country that is sort of ahead of the curve in terms of how it is effectively tackling this, and if so, what does that portend for other areas?
So it's really interesting that you asked this. We have spent like 3 months this semester talking to 95, close to 100 hunger relief organizations across the country. And so what we found is, I don't know if it's like a particular area, but there are definitely particular, I'd say, food banks that are more advanced. Like we've talked to one where they have an entire analytics group. That analytics team helps them really innovate in terms of how they not only satisfy hunger need, how they distribute food, how they connect with their suppliers. We've also identified others. So it's hard to say particular areas of the country as much as there are like certain food banks as well as agencies that are very innovative. There are some who have design projects with their local university. Several are partnering with their universities to try to advance the work that they're doing. There's a committee that Feeding America has that has kind of like these most technologically advanced food banks, and they use them to kind of identify best practices to share to others. The other thing that there is, though, is that part of why we can't say it's a particular area of the country is because the needs are kind of diverse in different areas in terms of I don't know if it's not so much the level of food insecurity, but maybe even the level of access to food. We've talked to some food banks where multiple counties in their service area have no grocery stores. And so the food that comes in from the food bank is the only source of fresh produce or grocery foods. We've talked to areas where even the food bank itself doesn't have indoor plumbing. And so the service region that they serve also, maybe 48% of the population has no indoor plumbing. And so then the needs that these different food banks are trying to address can be at multiple levels, depending on the region of the country that they're serving. So it's hard to say that a region is doing better, but there are food banks that are more advanced than others. And some of that has to do with the resources that they have available to them. Sure.
I'll take a moment to remind you and our viewers too, if you happen a staffer or somebody else who works with local food banks, Informs has a pro bono analytics program that connects subject matter experts like Dr. Ivy and Dr. Somerville and many, many others with organizations trying to use data and analytics to solve their challenges. And if you have a food bank that you think would benefit from this, please get in touch with Informs and we can certainly connect you with those experts.
Jeff, do you mind if I add just a little bit? Because I actually sit on the committee, and this is actually an invitation to both. Because as Jeff mentioned, we're kind of like the matchmaker. So we get the organizations, the nonprofit organizations that are dealt with the problem, and then we have a pool of fantastic volunteers. And so what we do is kind of that matchmaking. So we're also looking for organizations to help with, as Jeff mentioned, any food banks. We will be very, very happy. And Dr. Ivy is saying that there's so much analytics help that we can provide. And also for the volunteers, if anyone is interested to help us with this work, they can also reach out. And so this is called Pro Bono, Informs Pro Bono Analytics.
Great, thank you. So Dr. Somerville, let me turn to you. What are the most consequential actions that governments at the state, local, or federal level could do, short term and long term, to help build off of the types of challenges that Dr. Ivy was describing, and really tackling food insecurity?
Yeah, absolutely. So all of the governments at the three levels, the state, local, state, and federal, they're actually key players in this aspect. And we also know that the data is actually very siloed across the three of them, so it's not unified. So one of the things that the governments should probably start looking at how to potentially unify through maybe a platform where they can put all that data together, do the analysis to kind of understand where they are now and what are the key factors and what are the new actions, the next actions that they can make. So I do believe that kind of modernization as well as unification of their data will be extremely helpful, because there are insights that each level of the government might be missing that the other level does have. So that will be very helpful. And actually, again, Dr. Walsh, Secretary Walsh, she mentioned how all of the levels, all of the government should be really involved in this issue. And so if they all had access to the same data and the same insights, I believe that will be very helpful in terms of developing a unified strategy.
Great. Dr. Ivy, anything to add to that?
I would just second what Natalia said, that it's critical to look at the interconnectedness, because that will help us make better decisions, right? In terms of thinking about, there's a current decision around like free lunches that have been available to students K-12 over this pandemic that are coming to an end, and trying to think about, well, what is the longer term consequence or connectedness of that to thinking about food insecurity. And then that's happening, like those decisions are at the national, state, and local levels. If we could, bring data together, that would help, I think, inform decision making around like, what are the unintended consequences of different changes or legislation? And can we kind of project what might happen if we had data that was synthesized? So I had my health data with my unemployment data with my education data intersected. Then I could, even do simulation modeling or modeling like that to kind of propagate what the consequence of decisions would be. And then as we make choices, we would have a better sense of understanding the consequences on child, hunger or family hunger, things like that. I think at the highest level, those are things, the conversation. As Natalia mentioned, so the first of listening sessions that the White House is having was held yesterday. It's a series of webinars, listening sessions that will be all over the country, bringing together people thinking about hunger and health and how they intersect, in planning for a national conference. It's a great place, I think, for people from informs to engage, to connect with people who are on the front lines and understand the challenges, and also to talk about and share how we can think about making better decisions using information that we have available, and how we can think about creating this kind of connected database that could be used in so many contexts, and why that investment could be really worthwhile.
Thank you. So listening to you both, we're talking a lot about where we are now. But I think one of the questions that everybody wants to try to understand is thoughts about the future, which is very difficult to predict. But as you look at the trends, how do you see food insecurity over the next couple of years as the nation wrestles with the challenges of inflation and lingering effects of the pandemic and other sorts of ripple effects? Are we going to get worse, or are things going to maintain at the current levels? Dr. Somerville, why don't I start with you on that?
Sure. I am hopeful, and partially tied to what Jill and I right now are talking about. I mean, the technology is beginning to support more and more this and inform these decisions, the ability to bring data together to make those better decisions. So I am definitely hopeful. One of I do want to mention kind of a key encouraging project is one that has won the Edelman Award. Edelman Award is for us in my field is the Nobel Prize, and so the United Nations Food Organization, they won this award by building these amazing models that helped both define the food basket to provide to these really populations that are really need, and define that composition of the food basket in an optimum way. But not only looking at the composition of the food basket, but also how to source it from all the different vendors and all the different locations, how to source it in an optimum way. And that does matter. The optimum that I'm mentioning does matter, because that allows the organization to save lots of money and costs that then goes into more distribution. So they were able to serve more than twice what they would originally be able to save to serve, because they use this really advanced analytics, specific optimization, which is also the field that I love. So I'm hopeful. I'm going to go back to that. I am hopeful that analytics and data integration and all the new technology will keep supporting different organizations, the nonprofits, as well as governments, to keep making those better decisions, as Julie was pointing out.
Great. And Dr. Ivy, before I turn to you, since Dr. Somerville mentioned the Edelman Prize and the UN World Food Bank program, for anybody who's interested, there's information about that program on the Informs website. I believe it is on our impact page, or you can email me directly and be happy to connect you with that information or those folks. So Dr. Ivy, what about your thoughts as you think about where we are and where we're going?
I think that we're at a really critical time right now. And I think that we have the power to change what the trajectory could be. But I think that in the absence of doing anything, it won't get better by itself. I think that it has the potential to get worse simply because of things like inflation, fuel costs, and the effects of the pandemic that are lingering. But I think it gives us a really rich opportunity to innovate and to really be able to move the needle such that we could start dropping below even the 37 million that we had in 2019 through innovation. I think it's a really rich time because there's an influx, I think, at the national level of interest in really trying to look at food insecurity head on and hopefully trying to intervene when we can. And there's the potential, just as Natalia mentioned, from the as illustrated in the Edelman Prize with the World Food Organization, that we can maybe use technology, data analysis to help move that needle. But I think it's a critical time right now for us to act. And so it's kind of also an exciting time for people who might be interested in this and connecting. We have, some of the technology exists that didn't exist in terms of our ability to bring data systems together, in terms of our ability to start solving larger scale complex problems, in terms of our ability to visualize and communicate that to a broad stakeholder base so that it can actually help them make choices and decisions. So we're at a good time in terms of ability to make change and intervene so that we can kind of nip what we might be seeing form in the bud.
Well, I certainly appreciate your optimism as you think about the technology and how we think in order to be able to drive that on an issue that is so critically important, and yet all too often people may not think about it the same way because it doesn't make the front page of the papers the way that other also pressing issues do. So with that, Dr. Ivy, Dr. Somerville, I want to thank you both for a really interesting and really important conversation. For those of you watching, if you're interested in setting up a briefing with either Dr. Somerville or Dr. Ivy, or even other Informs experts on other topics, please feel free to get in touch with me or Ashley Smith at Informs, and we'll be delighted to connect you. We encourage you to look at the other webinars that we have done, and we'll keep you posted on upcoming ones. So thank you everybody for tuning in. And again, Dr. Ivy, Dr. Somerville, thank you both very much for all that you're doing, not just with this webinar, but in terms of making a difference for everybody. Take care.
Thank you.
Thank you.